Good afternoon, and thank you for joining us for today's COVID-19 media briefing. This is a Q&A about vaccine. It is being aired live on YouTube. Joining us today are DHS Deputy Secretary Julie Willems-Van Dyke and Dr. Ryan Westergaard, Chief Medical Officer in the Bureau of Communicable Diseases. And we begin with remarks from Deputy Secretary Julie Willems-Van Dyke.
Thank you. Good afternoon, and thank you to all of you for joining us. As of today, we have administered over 5.7 million doses of COVID-19 vaccine in Wisconsin, and almost 50% of Wisconsin residents have completed their vaccine series. We continue to make progress, and we need to double down on our effort and make even more. When I share these next numbers, please remember two things. Every one of these numbers, the cases and the variants and the people we have lost, represent your neighbors in this state. And also, I'd like you to know that I am not sharing these numbers with the intent to scare you. I'm sharing them so you have accurate information from a trusted source so you can make important decisions for yourself and for your family. Our 7-day average of confirmed cases here in Wisconsin is 242 cases per day, which is 2.8 times higher than where we were 2 weeks ago when our 7-day average was 85 cases per day. Increases in cases are occurring in every state in the nation. And Dr. Rochelle Walensky, director of the CDC, reported yesterday that 83% of sequenced cases were the Delta variant. Our state lab of hygiene is reporting the same trend here in Wisconsin, with an increasing proportion of sequenced samples representing the Delta variant. And what we know is this variant is extremely infectious, and it will spread even more quickly than any form of COVID we have seen to date. And it will spread most effectively to those who are not vaccinated. And more infected people means we will see more hospitalizations and more deaths. Over the past 2 weeks, we have seen Wisconsin hospitalizations rise from 74 people with COVID hospitalized across the state to 143 reported yesterday, almost double the patients. Nearly all of these patients could have avoided this fate if they had been vaccinated. So why didn't they? Many of them received incorrect information about vaccines via social media or friends or family members who were also informed by errant sources. Last week, the Surgeon General released a report on misinformation that details how this happened and what we can do to combat it. The threat of misinformation comes to life even more when you hear the words of critically ill patients with COVID. Dr. Brittany Kobia, a physician in Birmingham, Alabama, has recently shared her experience with patients begging for vaccine as they were about to be placed on a ventilator. I hold their hand and tell them I'm sorry, but it's too late, she said. They cry and they tell me they didn't know. They thought it was a hoax. They thought it was political. They thought because they had a certain blood type or a certain skin color, they wouldn't get as sick. They thought it was just the flu, but they were wrong and they wish they could go back, but they can't. I'm painting a pretty grim picture, but there is a way out of this, a way to stop these increases in cases, hospitalizations, and deaths, to stop the spread of the Delta variant, and to help prevent future variants from developing. And we do that by getting vaccinated, by getting our children who are eligible vaccinated, by talking to our family and our neighbors about the importance of getting vaccinated. This is how you protect yourself. and how we protect our state. We've said it before and we'll say it again. Every COVID-19 death is now a preventable death. And I know we have so many grieving families here in our state and across the country. I know this virus has touched so many of us and has already caused so much pain and grief. And even for those families whose loved ones pulled through, I've seen the stress this virus causes, the physical strain of the illness, and the emotional strain on the entire family. Please don't let that be you, and don't let it be your family. At this point in the summer, getting eligible children vaccinated is a priority. For children aged 12 to 17, the Pfizer vaccine is currently available. And because the Pfizer vaccine requires 2 doses spaced 3 weeks apart, and then another 2 weeks after the final dose to build full immunity, kids need to get vaccinated now to be fully protected by the time school starts. Not only does the vaccine protect our students and make in-person activities safer, it also can help make parents and guardians' lives easier because vaccinated children don't have to quarantine after a close contact. Of course, the same goes for fully vaccinated adults, so it's helpful to the entire family. I know we all want the best for our children and our families, and I can tell you, as a public health leader and as a nurse, I trust the vaccine. As a patient myself, I trust the vaccine. And as a mom, I trust the vaccine. My grandkids are still too young to get the COVID-19 vaccine, but when it is approved for younger children, I will trust the vaccine for them as well. So please get vaccinated and get your family vaccinated. Thank you. And with that, I will turn it back to you, Elizabeth, and we welcome your questions.
Thank you, Deputy Secretary. And a reminder to maintain audio quality, we ask you to remain muted until it's time to ask your question. If you're able to do so, use *6 to mute and unmute your phone. Today, we do need to wrap up on time. So in the interest of time, to ensure everyone is able to ask a question, we ask you to limit yourself to just one question. And we begin today with Gretchen Gerlach at WMTV in Madison. Gretchen.
Hi. Hi, this is Gretchen. Hoping you can hear me. My question for you, what percentage of new COVID-19 cases are people that are fully vaccinated? We know that Dane County, we have those those numbers, but do you have an idea as far as the state goes?
Dr. Westergaard, do you have that data available?
We, on an approximately weekly basis, aggregate the number of cases that occurred in both vaccinated and unvaccinated cases. We can share those but I don't have the percentage calculated right now, but we'd be happy to get back to you.
All right, we'll be happy to get back to Gretchen, and we will move on to Scott Bauer at the Associated Press. Scott Bauer.
Hi, thanks for doing this call as always. Just wondering if there was any concern from where you guys sit with the huge gathering today in Milwaukee for the parade and for the game the other night with, you know, upwards of 100,000 people gathering together, most of them not wearing masks. Any concern from your side?
Well, first of all, let me say, go Bucks. We're really, really proud of our state and our incredible basketball team. And in answer directly to your question, Scott, yes, we are concerned. We know people wanted to be jubilant and celebrate, but we know, as I said, half the state is fully vaccinated, and so half the state is not. And I assume the same applies to the people who are in the Deer District or in the arena. And I didn't see half of the participants wearing a mask, which would be the recommended behavior for someone who is not vaccinated. So both that combination of unvaccinated people, likely unvaccinated people without masks in those close settings, the fact that people were really boisterous and yelling loud, which is a great way to spread infection, the presence of the Delta variant in our state, I anticipate we'll see additional cases as a result of those gatherings. So really just want to double down. If we want to continue to have those kind of gatherings without that sequelae of increased cases, we need to all get vaccinated. And if you're not vaccinated, wear a mask. And honestly, even when lots of people are close together like that, whether you're inside or outside, it makes a lot of sense for everybody to wear a mask in those situations.
Thank you for that. Let's give the next question to Alex Moe at WIS Business. Alex Moe.
Thank you. Could you please identify where the hotspots in the state are for rising COVID-19 cases and how they compare to vaccination rates for those counties?
Dr. Westergaard, do you have any data related to that?
There are two regions where hospitalizations are significantly increasing compared to before, and it's the Southeast and it's the Fox Valley regions. Cases are up all over the state, just as all over the country. But when we talk about the severe illness requiring hospitalization, those are the two regions that seem to be leading the curve in terms of an increase in morbidity. I can direct you to our website that has a hospital capacity tab where you can find that information. The same information is available for vaccine status by region and by county. And you can get the precise numbers by reviewing those data that are posted.
And one thing to add, no part of our state is adequately vaccinated. We have said all along, we are seeking at least an 80% vaccination rate. There is no county in the state that has achieved that.
Thank you for that. We go now to Bill Miston at Fox 6 in Milwaukee. Fox 6 in Milwaukee.
Thank you for taking this call. Is there a concern about other variants besides the Delta variant? I know we've seen a lot of reporting of the, I believe it's the Gamma variant out of Illinois, considering its close proximity to the state.
Dr. Westergaard?
Yeah, I think this requires ongoing surveillance and vigilance, because there are a finite number currently of what we call variants of concern that are concerning by virtue of either their increased transmissibility, high level of viral load that people who are infected have, which makes them more infectious earlier in the course of their disease, and some of the variants mitigate against those risks are to reduce transmission, and vaccination is the best way to reduce transmission right now.
Thank you for that. Let's go now to Sean Kirkby at Wisconsin Health News. Wisconsin Health News.
Hi, thanks for holding this today.
Just was wondering, the July 4th goal for having 70% of the state's adult population being vaccinated has come and gone. Do you think the state is going to be able to hit that benchmark of 70%? And if so, when? Thank you.
Well, Sean, we didn't hit it by the 4th of July. And to clarify, that goal was 70% of adults over 18 would have had at least one dose, was the goal that the president set out as an interim goal. I want to be really clear. Sometimes people have interpreted that as the final goal. That is not the final goal. At least 80% is the final goal. And truly, the best scenario would be 100% of people being vaccinated. We did not hit it. I believe we're at about 63% of adults in Wisconsin have received at least one dose. And, you know, to be frank, we could hit 70% within the next couple of days. We have plenty of vaccine. We have plenty of providers. We just need people to raise their hand and say they will get vaccine. So it's really hard for me to predict when that number will happen. We're not letting up. We're going to continue to vaccinate. We're really working with healthcare providers and asking our healthcare providers to offer vaccine at every setting they encounter a patient. So we have no what are called missed opportunities. Everyone who comes to an ER, everyone who's discharged from a hospital, everyone who's seen, you know, their primary care provider for anything that would allow them to get vaccinated. Our pharmacies still have lots of vaccine. Our local health departments continue to hold clinics. There are vaccines at events throughout the state, including down in the Deer District Tuesday night, thanks to our National Guard vaccinators who were there. So we could be there anytime that our population says, I don't want to get the Delta variant. I don't want to get COVID. I don't want to be at risk of hospitalization. Please get me that vaccine.
Thank you for that. The next question to Rory Linnane at Milwaukee Journal Sentinel. Rory Linnane.
Hey, thank you. Thank you. The CDC guidance for schools now distinguishes between students and staff who are vaccinated and not vaccinated and calls for requiring masks for those who are not. Do you recommend that schools track which students and staff are vaccinated for the purpose of mask requirements or for informing other precautionary measures? And would school districts have the authority to go further and require vaccination for students and staff?
You know, here's what I'd say, Rory, about masks. That's like the floor of the recommendations that CDC has made. And if you read the entire document, you'll also find that CDC makes recommendations that refine that even further. So for example, with elementary schools, we know no children are going to be eligible to have been vaccinated yet because they are too young. And so CDC recommends in the case of elementary schools, they may full well want to consider just requiring everyone, even vaccinated teachers and staff, to wear masks for good role modeling and so that there is no question about, you know, who's vaccinated, who's not, why do I have to wear a mask when my teacher doesn't, and to provide, again, that additional layer of protection for our youngest children who can't yet get this safe and effective protection from the vaccines. Likewise, CDC also is very clear that when disease rates are high, everyone should wear everyone should wear a mask and get vaccinated so that disease rates will decrease. But everyone should wear a mask when disease rates are high. So it's not just quite as black and white as if you're vaccinated, wear a mask. If you're not vaccinated, don't wear a mask. In terms of how schools will enforce this, as we've talked about throughout the pandemic, schools are led by local school boards and local superintendents, and we encourage them to think about the most protective way to ensure the safety of their students. But those decisions are decisions that will be made at a local level.
Thank you for that. We go now to Will Cushman at WisContext. Will Cushman.
To breakthrough cases, possibly, who might have any just data on the like recorded cases in the state so far, and either way, can you talk a little bit about why
Will, I don't know if you can hear us, but we are having a hard time hearing you. You are breaking up. Can you try your question again, please?
Hi there. Yeah, sorry. Can you hear me better now?
Yes, thank you.
Okay, awesome. Sorry about that. I want to go back to breakthrough cases, and I'm curious. You may not have a percentage of the number of new cases that are breakthrough cases, but do you have a raw number for the number of breakthrough cases that have been reported in the state so far? And either way, can you talk a little bit about why, in your view, getting vaccinated is still really important, given that there are a small number of fully vaccinated people who are testing positive for COVID still? Thanks.
I can take that. Well, we have some data aggregated from January to July. I can read you those numbers, and like similar to the previous question, or we can follow up by email if you'd like more details, because I think it is important. Since January, we've had 145,759 confirmed and probable cases among not fully vaccinated residents. And over that same time, we've had 2,390 confirmed and probable cases among fully vaccinated people. So for that period, means that 1.6% met the definition of a breakthrough case, which means that 98.4% of cases are occurring in people who have not been fully vaccinated. So the number is probably a little bit more severe, even greater when we're talking about hospitalizations, because many of the breakthrough cases that we're seeing are among people who are being tested without symptoms in certain settings. So the data tell an even stronger story when you look at the proportion of people who develop severe disease, because among people may still test positive after being vaccinated, but the chances that they will have severe disease and be hospitalized is dramatically lower. So those are the numbers that are generated by our epidemiology team. I think the take-home message is that high 90% reduction in the risk of disease, and that's really the simplest reason why we recommend vaccination at this point and at every time. There's no vaccine that's ever been 100%, but when we're talking about a virus that left unchecked will essentially infect every human on the planet, having a tool that can reduce the risk of hospitalization and death by 90% will save millions of lives. This is one of the most powerful public health interventions that we have at our disposal right now. It's foolish of us to not use it to the greatest extent possible. So it's really, really important that we help people understand that although vaccine breakthroughs happen, when you look at the magnitude of reduction in risk, we have many, many lives to save by encouraging vaccination among as many people as possible.
And if I can just add on, how many cases of polio do you see? How many cases of measles do you see day to day? How many cases of diphtheria do you see day to day? The reason these diseases are not present in our population and are not killing us like they did generations ago is because we have highly effective vaccines that did not have social media spreading misinformation about them that people fell prey to, and that the population got those vaccinations and we nearly eliminated those diseases and certainly have brought them down to a level that is almost undetectable to most people. So that's what Dr. Westergaard is talking about. And that's what COVID-19 vaccine can do for our population. 98.4% of our cases are in unvaccinated people since the first of the year. That shows this vaccine works.
Thank you for that. Let's go now to Rob Sussman, WTAQ in Green Bay. Rob Sussman.
Hi, thanks for taking my question. You touched on it briefly in regards to, the people who are hesitant to get the vaccine, and you had mentioned the misinformation, so on and so forth. My question is 80% vaccinated still a realistic goal given the social cultural division in the United States and in the state of Wisconsin? Thank you very much.
Never say never, Rob. And, what I'm hearing from colleagues in states like Arkansas and Missouri, where their hospitals are once again overflowing, where the kinds of stories that I quoted from Dr. Copia are spreading amongst unvaccinated people, they're starting to see an increase in people accepting vaccine. So I think it is possible. Or I wouldn't be putting one foot in front of the other and coming to work every day. I mean, we have to believe that's possible because, first of all, we are so act like it just stopped cold. We still get 3,000 to 4,000, some days 5,000 to 6,000 new vaccine series started every day. And so that's poking along. That's not like, tens of thousands like we saw in the spring every day, but it will get us there. And I think if people can start to also hear a more balanced view of the safety and effectiveness of these vaccines, if we can start covering the percentage of people who do not have breakthrough cases, who are protected by this vaccine, if we can get that message out rather than, really obsessing over the relatively few breakthrough cases, I think it will also help for people to have a full and fair picture of what this vaccine can do.
Thank you for that. Let's go now to Josh Pagaro, WBAY in Green Bay. WBAY in Green Bay.
Hello, thank you so much for taking my phone call. My question is, this was mentioned early in the start of this conference, is the Surgeon General's warning on misinformation. I know even President Biden has addressed it. Does the Department of Health Services in Wisconsin have some sort of strategy to give people what's right and what's not in terms of increase in boosting the vaccination rate? Is there a strategy? Thank you.
Well, absolutely. We have an evidence-informed media campaign underway right now. Last week, we released a campaign with local doctors throughout Wisconsin talking about the effectiveness of the vaccine, because the evidence shows that one of the most trusted groups of people for information about vaccine are healthcare providers. Our strategy is also, as I mentioned earlier, working with our trusted colleagues, healthcare providers, to increase access and discussion of vaccine across the state. We've certainly, throughout the pandemic, been a source of trusted information. In fact, in polling that we have done, we have found that DHS is second only to CDC as the most trusted voice for information in the state of Wisconsin. Now, I do know that may not be true for those who are not yet vaccinated, that they may find other voices, trusted voices, and I'm happy to see that some of the news networks and leaders across the nation who may not have been as outspoken about the need to get vaccinated are starting to do to promote vaccine across the nation. And I think that is also an important step forward. And let's clarify what is true What is true is that vaccines are safe and vaccines are effective. And without a vaccine, you are a sitting duck for COVID-19.
Thank you for that. We go now to Victor Jacobo, CBS 58 in Milwaukee. Victor, CBS 58.
Hi, good afternoon. Thank you again for taking the call. You kind of addressed this, but not with numbers. I was wondering, with statewide hospitalizations, if you have like a bird's eye view. I know recently you talked about how it was about 90% of those who were unvaccinated who were hospitalized. I'm wondering, is that still consistent, or has that number lowered because of the spread of the variant, or do you have a number of 90-some% are the hospitalized are unvaccinated versus vaccinated? Thank you very much. Bye.
Dr. Westergaard, can you comment on our data there? Oh, you're muted.
Sorry, I don't have the corresponding number of cases, hospitalizations for in the same way that I do positive tests, but we can work on getting that for you if you want something precise.
We'll say our data are related to interview of patients, and so it is not, we don't have it, you know, for the 143 patients who are hospitalized today. But what I can say is this is data that is being tracked across the nation. It is being tracked in places where we are seeing much worse situations that we are in right now. And the data are holding in terms of the effectiveness of the vaccine, that upwards of 90% of patients hospitalized in with COVID-19 are people who are not vaccinated. In fact, some states are reporting 100% of the patients who are hospitalized. So.
Thank you for that. Next question to Katrina Nickel, Fox 11 in Green Bay. Katrina at Fox 11.
Hi there. My question for you today is DHS making any more efforts to do more sequencing? I know previously, you know, there were only a few labs. Has the number of labs testing for the genome sequencing for the Delta variant and other variants increased lately?
Yes, that's a good question. Our goal with our colleagues at the Wisconsin State Lab of Hygiene is to make as many positive PCR tests possible available for sequencing. And one of the strategies that we've recently done for that is through the Wisconsin Clinical Laboratory Network, which includes a large number of laboratories that serve hospitals around the state. We've requested that they send 100% of the residual specimen from positive COVID-19 PCR tests to the state lab or one of the other partners that can do whole genome sequencing in order to be sequencing to get the genotype data. So we have the laboratory capacity to do that now at the current level of positive tests, and it can provide another dimension to our data. So we want to use that capacity as best we can. The challenge is the logistics, because people are tested many different labs in many different places. So it can sometimes be a complicated process to actually capture the residual specimen from the patient. But we are, now striving to get as many of those as possible, and that percentage of positive tests that get sequenced will continue to go up.
If I can just add one more thought around sequencing, is it is an incredibly important activity for us to understand the evolution of the pandemic, as Dr. Westergaard mentioned. But sequencing itself is very time consuming. They're looking at all of the DNA of the virus itself. It is not, you just stick it in the machine and it tells you what it is. And so to properly sequence can take, from collection of a specimen through the transportation, through the receipt at the lab, through the whole process, can take several weeks. And so this is not what we use as like the real-time analysis of the pandemic. We're seeing cases going up even before we're seeing the results of the sequencing that might show how prevalent the the Delta variant is. So there is a time lag here. And I think what's really important is we're watching the case numbers, which are reflective of what we will likely be seeing as the sequencing evolves over the next couple of weeks.
Thank you for that. We go now to Katrina Lim, News 18 in Eau Claire. Katrina, News 18. News 18 in Eau Claire, remember *6 will mute and unmute your phone. All right, we'll try to get back to Eau Claire. Let's move on to Mitchell Schmidt at the Wisconsin State Journal. Mitchell Schmidt.
Yeah, thank you very much for the call today. I appreciate it. With regard to the upcoming fall semester approaching, I was wondering if DHS would have any sort of recommendations to colleges or campuses just with regard to requiring students to submit records or proof of vaccination to kind of better understand the level of protection on various campuses across the state. Thank you.
Yeah, I think the most important thing is that colleges and campuses are encouraging their students to get vaccinated and making it very easy and available, especially at the beginning of the semester for those who have not yet taken that step over the summer months. So we are working with the university system in supporting them in ways to get vaccine available. Many of them are doing vaccination at orientation events throughout the summer. And many of them are setting up systems to communicate with their students about verification of vaccine. So the key thing is accessibility to vaccine, clear information, factual information to students to make their decisions, and then easy access to complete a vaccine series. Because as we know, COVID spreads very readily in congregate settings, and most college students are living in a congregate setting with a lot of people fairly close together, whether it be in a dormitory or off-campus housing. And I know universities want to go back to in-classroom, face-to-face instruction where there'll be many students close together. So really, to control the spread, we will need our population of university students to be highly vaccinated.
Thank you for that. The next question to Hope Kerwin at Wisconsin Public Radio. Hope at Wisconsin Public Radio.
Hi, my question is also about universities. Last fall, some college towns saw increasing numbers of COVID-19 cases in the community when university students went back to school. And so I just wanted to ask if that is a concern this year, especially given that only about 40% of like 18 to 24-year-olds in the state are currently fully vaccinated.
Dr. Westergaard?
I'd say yes, it's a concern. That was a very clear pattern that we saw last year. In fact, the beginning of our fall surge really started the week after many campuses opened to students. So it was a contributing factor, not necessarily the main or the only contributing factor. So now is the ideal time for people who will be attending universities in the fall to get vaccinated so they're fully protected by the time they come back. So, we know that this is how it works because we have the data. We have, September of 2020 told that this is what happens when susceptible people come back from all over. We also know, based on vaccine efficacy data, that it's completely preventable. So let's prevent it. Let's make sure that people are coming back to schools who are eligible for vaccine all get vaccinated, and then we can prevent that phenomenon from happening of people's increasing transmission on campus settings and spilling over into the community. There's no reason to expect that needs to happen, and all we need to do is really persist in increasing vaccination in order to prevent it.
Thank you. Next question to Eric Gunn at the Wisconsin Examiner. Eric Gunn.
Hi, thank you for taking this.
wonder if you could speak to what progress you may have seen in reaching people who do want the vaccine, but for whom access has been more challenging. You've mentioned certainly in the past concerns about rural areas as well as parts of the urban areas and urban populations. So do you feel like there are some changes that have come along in terms of being able to get those parts of the population more vaccinated? Thank you.
Well, I think our vaccinating partners throughout the state have done an incredible job of providing a number of different pathways to vaccine, including even going door to door in parts of the city of Milwaukee where we know vaccinations are low. Again, door to door to offer vaccine to people who want it, not to force vaccine on anyone. Our pharmacy network remains incredibly robust, and there are pharmacies nearby to many, many people across the state. They're easily accessible via bus lines. In the fall, we are rolling out the K-12 school testing program, but also working with schools on vaccination on site in schools, or vaccination community clinics on site. Our universities will have clinics. And again, I think this piece about working with our healthcare providers is essential. Because we know most of our population to ask for support is there are certainly people who are worried about getting vaccine because they're worried about side effects and they're worried about missing work, either missing work to get the vaccine or for those side effects. So asking employers to continue to be very supportive of their employees getting vaccinated and providing support through paid sick time for them to do so if they're to get the vaccine, and haven't yet gotten there.
Thank you. The next question goes to Nick Bohr at WISN in Milwaukee. Nick at WISN.
Good afternoon. I just had a question for Dr. Westergaard. Julie had quoted that doctor from Alabama earlier. I wondered if you'd had any experiences like that, or at least heard of experiences like that, where people had talked about regretting not getting vaccinated, but it was too late to do it at that point.
No, not personally. Thanks for asking. My practice is generally in the outpatient setting, and I have had conversations with people who are skeptical about the vaccine, and it's been generally pretty productive. I think a lesson that we've learned over and over that I have personally experienced is that people who decline a vaccine at one point are not necessarily going to always decline a vaccine, and when we have good reason to think that one of the most useful things in helping people change their mind is having a conversation with the healthcare provider that they know and trust and have some experience with. That's certainly been my experience with the patients that I see. In fact, some of them said, I haven't gotten vaccine. I was waiting until I could talk to you about it. So I think there's so much that good that can be done in healthcare settings because people who come to their provider that they know really trust that the information they're getting and the recommendation that they're getting is in their best interest. So that's, I think, an important part of our strategy is to equip and empower and support all of our healthcare providers, physicians, nurses, and all kinds of dentists and pharmacists, anyone that really has the opportunity to have health-related conversations about people to say, yes, I strongly recommend the vaccine. And if they have questions, to first sit and listen, and then provide the best information that we can. So I think there's a lot more good work that can be done in those conversations.
Thank you. Next question to Sarah Seifert, Eau Claire Leader Telegram. Sarah, Eau Claire Leader Telegram.
Thanks for taking my question. Dr. Westergaard, you said last spring that there may have been 10 times as many COVID infections than there were positive tests. Is it your sense that the same thing is true for the Delta variant right now? And do you have any sense of how many Delta variant cases there might actually be in Wisconsin right now compared to how many have been sequenced?
Yeah, thank you. It's a good question. And the general principle is that because the very tricky thing about this virus is that people can spread it easily when they don't have symptoms. That has been one of the biggest challenges for controlling the virus. And it also results in the situation that you described, that when we count how many people are test positive, we're only testing a tip of the iceberg, meaning that a lot of people, for every positive test that we have, there may be other people who haven't yet had symptoms, who haven't thought yet to have a test. The excellent question, of course, is how big is the tip and how big is the iceberg? And that's really been a challenge to quantify. But I would say in our data right now, in addition to seeing our cases go up, our percent positivity rate is also going up. And that's really one of the metrics that we look to of, are we testing enough people? And in June, the statewide, the percent of tests that got done that were positive was less than 1%, and now it's more than doubled. It's I think 2.8% when updated yesterday. So that tells us in general terms that yes, cases are going up, and there's more cases than we realize because a higher proportion of the tests that we do are positive. But it's hard to give a precise estimate of how many we're missing, but we know we're missing many. So an important outcome of that, the recommendation of that, which has been the same all along but bears repeating, is that anyone with symptoms that could be COVID, especially now, it's important to think about because the common cold is circulating in addition to COVID-19. So if people have a common cold and they're coming down with something right now that could be COVID, it could be other things, it's very important that people that have symptoms get tested. And on the other side of asymptomatic testing, it's really important that we persist with the public health activities of contact tracing and notifying people who've been exposed, because those folks should also get tested, even if they're not having symptoms. So that's how we minimize that, the non-tip of the iceberg is to make sure that we're testing in the right places. And that's everyone with symptoms and everyone who's been exposed. And we don't talk about testing as much because we talk so much about vaccination, but it's important to know, that there is testing available in all areas of the state, in healthcare settings and in pharmacy and other settings. And we're still encouraging people to go get tested at one of the options there, including a growing number of home testing options that people can make sure that they know their test result if they get symptoms or they need to know because they've been exposed. So thanks for asking that.
Thank you for that. Next question to Emily Files, WUWM Milwaukee. Emily, Milwaukee NPR.
Hi, what do you make of the conflicting guidance between the CDC and the American Academy of Pediatrics on masking in schools? And will DHS offer its own masking guidance for schools to help clarify?
I think it's, I would say this. I don't think there is that much conflict between what the American Academy of Pediatrics has recommended and what the CDC has recommended. I went and reviewed the AAP recommendations last night, and they cite the CDC guidance continuously throughout their guidance. They both talk about layering multiple layers, multiple levels of protection to help keep children in school as safe as possible. It's not just one thing. It's looking at a combination of how prevalent is disease in your community, how high are vaccination rates, and then what are the different levels of protection that we need to provide to our students, including testing, contact tracing, isolation, respiratory hygiene, kids staying home from school when they're ill, teachers and staff staying home when they're ill. All of these things are important about protecting students. So the one place there are some fine-tuning differences between the AAP and the CDC is that they did recommend universal masking, whereas CDC, as I talked about before, has recommended in general masking for those who are unvaccinated and no need to mask for those who are vaccinated. But remember, the CDC also provides caveats on that too about when you should go to universal masking. So the difference between the two is not this, it's about this. And I think the important thing to remember is it is never going to hurt anybody to wear a mask. And if we are seeing disease rates increasing, and particularly if you are in a community with increasing disease rates and low vaccination rates, it is as simple as changing the recommendation in a school to say, you know, today, from here until we see different circumstances, we're going to protect all our kids by requiring masks. And you know what? The kids, for the most part, are just fine with that. They will wear the masks. They understand, and they want to be in school. And so all of us working together to interpret these different types of guidance in the context of what is happening in your community and with an eye on doing the safest thing for kids. I think we can do a great job of protecting our children and our faculty and staff in our schools.
Thank you for that. We have made it through our list. We're going back to one reporter who was not available when called on, which is Katrina Lim at News 18 in Eau Claire. Katrina at News 18 in Eau Claire, are you on the call? *6 will mute and unmute your phone. News 18 in Eau Claire. All right, well, with that, we will wrap up today's briefing. We want to thank Deputy Secretary Julie Willems-Van Dyke, Dr. Ryan Westergaard, and all of you for participating. We will schedule our next briefing as needed. In the meantime, we ask you to continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.